What is the staff-to-child ratio in specialized daycare? Have you ever wondered how many caregivers are there for each child in specialized daycare programs? This is especially important for children with autism spectrum disorder and other special needs. The staff-to-child ratio plays a vital role in ensuring that each child receives the attention and support they need. In specialized daycare programs, the ratios are typically lower than in standard daycare settings. This is to provide the individualized support that children with autism spectrum disorder requiring. The exact ratio can vary based on the severity of the child's needs and their age. For instance, when caring for children with severe disabilities or multiple special needs, the common ratio is 1 staff member for every 4 children. This allows for closer supervision and more personalized care, which is essential for addressing complex needs. If a child has intellectual disabilities or physical impairments, the ratio may increase slightly to 1 staff member for every 5 children. This still allows for a good level of attention while managing the various needs of the children. For children with milder developmental delays, a ratio of 1 staff member for every 6 children is often observed. This ratio helps ensure that children receive adequate support without overwhelming the staff. When it comes to children with specific learning disabilities or speech and language impairments, the ratio can be about 1 staff member for every 8 children. This is a bit higher, but it still allows for effective support and intervention. Younger children, especially infants and toddlers, requiring even lower ratios to ensure they receive the care and attention they need. For these age groups, a common ratio is 1 adult for every 3 for infants or toddlers. The staff in these specialized daycare programs are usually trained in strategies specific to autism spectrum disorder. This training enhances their ability to support children effectively within these ratios. Smaller ratios enable staff to implement individualized care plans, manage behaviors, and support social-emotional development in a safe environment. Compared to typical daycare settings, specialized programs maintain stricter ratios to accommodate the unique needs of children on the autism spectrum. For example, while a general preschool might have a ratio of 1 staff member for every 7 or 8 children, specialized autism daycare programs often maintain ratios closer to 1 staff member for every 4 or 5 children, depending on the child's needs. Overall, the staff-to-child ratio in specialized daycare for children with autism spectrum disorder is carefully determined to balance safety, individualized attention, and therapeutic support. This often requires more staff per child than standard daycare settings, ensuring that each child receives the best possible care and support.